So who in this class has like a really specific morning routine? Anyone? What do you usually do? Like what time do you wake up in the morning?
6:45.
Okay, so today I have to wake you up at 5:30, right? What do you usually do after you get up?
I go to the bathroom and I brush my teeth.
Okay, so that's fine. What else do you do?
Then I usually come back in my room, put my robe on, I make my bed.
Okay, so your robe is actually in the laundry, so like we can give you like scrub pants if you want. Like, what do you do after that? Do you usually go to class, something like that?
Make breakfast.
Do you eat breakfast?
Yep.
What do you get?
I usually eat cereal and oatmeal, eggs.
Okay, yeah, so all we can give you today is like yogurt and a fruit cup. Okay, so how are you feeling right now?
Sad.
Flustered, angry, don't really understand why I'm doing this? Okay, so I want you to take that kind of standard of care and think about that every day. This is the kind of care you get in assisted living facilities most of the time. I want you to take that kind of care and apply it to a patient with dementia.
So a lot of the times individuals with dementia are seen as being an empty shell. They're seen as not being able to make choices for themselves, and they're seen as not having an independence. They're dependent on other people for care. But what exactly is dementia? So dementia is a neurological disorder characterized by a decrease in mental ability that interferes with everyday life. There are a lot of different kinds of dementia, but the most common type is Alzheimer's, encompassing about 60 to 80% of all dementia cases. Other types of dementia exist. Some are caused by a condition like Parkinson's disease, some are caused by medication, and some are progressive. Dementia affects between 5 to 7% of adults over the age of 60, and this prevalence increases with age. So as the adult population ages, we're going to see more and more cases of dementia arise. It usually affects women more than men and is the 6th leading cause of death in the United States. 1 out of 3 seniors will die with dementia or Alzheimer's disease. But what causes dementia? Dementia is caused by damage to the nerve cells in the brain. So here you can see a healthy brain. All the nerves are intact, it's nice and full, there are these spaces, but they're supposed to be here. And then on the other side is what a brain looks like with advanced Alzheimer's disease. So here you can see that the nerves are becoming damaged. The brain is smaller, there are a lot of more spaces, and it just isn't functioning the way it should. So dementia affects people differently depending on where in the brain the nerves are damaged. So a lot of the times people think that dementia is memory problems, but it's not just a memory loss. There's a lot of other cognitive and psychological changes that happen during dementia as well. An individual with dementia will experience memory loss, but they will also experience confusion, disorientation, this inability to reason, behavioral and personality changes. It's also important to recognize that dementia, especially progressive forms of dementia, exist within a spectrum. There are stages of dementia. So in the earlier stages, an individual with dementia may be completely independent. They may be able to drive, go to work, participate in the community, but they may start to notice these memory lapses. They may start to notice that they're having difficulty coming up with the right word, or they may be misplacing valuable objects. In the later stages of dementia, individuals are recognizing that these memory problems are becoming more prevalent and they're becoming more severe, and they're starting to notice more personality and behavioral changes as well. They're now realizing that they're forgetting their own personal history, major events, they're getting lost, they're disoriented and confused, they're no longer able to react in their environment in the same way, and really it's now taking a toll even more so on their everyday life. So as an individual with dementia, as their disease progresses, they're going to become more dependent on the care of others. A lot of the times they'll be introduced into an assisted living facility or a skilled nursing facility where they require high assistance 24-hour care. So whether these individuals are at the earlier stages where they're independent or at the later stages where they're dependent, they're going to experience a lot of challenges in their everyday life. They're going to experience a loss of independence, a loss of autonomy, a loss of choice, a loss of self-identity, self-esteem, personal belongings, and a lot of these factors are held very high within our society, especially independence and autonomy. And it's important to recognize that throughout all the stages of dementia, that these individuals should maintain autonomy, the right to choose for as long as possible. Too often we take away their autonomy too early within their condition, and this makes their independence deteriorate quickly. So now we're taking an individual with dementia, taking away their right to choose, and they no longer have this purpose in life. They no longer can make choices for themselves. They become more frustrated, agitated, confused, angry, and you see a lot more behavioral outbreaks in these individuals when we take away their autonomy. So now we're not only dealing with dementia, but we're also dealing with these behavioral outbreaks that could be prevented. And so dealing with an individual with dementia and treating them, it becomes very complex and requires a lot of patience and understanding.
So now what coincides with patience and understanding is patient-centered care. These patients should be the most active player in their treatment and care plans, and we're just going to be the support system to help them along the way. There's a lot of research and literature out there that supports various approaches to help us work with patients with dementia. Literature suggests that in the beginning stages of the diagnosis of dementia, they should start writing things down, such as like their daily activities, what they do every day, their hobbies, and what they enjoy to do. So that maybe later in life, if they have a caregiver or in a skilled nursing facility, the caregivers and the medical care professionals can utilize these into their care plan and their treatment plan in order to carry through the autonomy throughout the various stages of dementia. By utilizing their daily routine that they've been doing for 30 plus years, we are much more likely to make them more comfortable in their new environment, increase outcomes, decrease the burden effect, and just respect them for the individual, the unique individual that they are. So now I have a question for you guys. How many on your clinicals have seen a patient with dementia either be ignored or like a healthcare professional just didn't try to talk to them and connect on some level? Yeah, a lot. So definitely the treatment for these individuals is definitely not up to par. Our traditional medical paradigm just treats them and perceives them as a burden to our society and takes away their autonomy. Like Mike said before, these patients aren't asked what to do, they're told what to do. Their voices are being taken away, and they're seen as this empty shell that is physically there, but is void of emotions and feelings. In skilled nursing facilities and assisted living facilities, they give them like the basics. They give them water, food, shelter, in order to live. But the question is, are these people actually living? Are they living life are we helping them live their life to its fullest? We need to get to know these people for who they are and their hobbies and their joys in their life, and then use this in your treatment plan. So I have a metaphor that I like to use with you guys to describe a patient with dementia. So we have this bucket full of water, okay? So the water's filled all the way to the top, and there's holes at the top, okay? So if we keep putting new water in, it's just going to flow right out. The bucket can't hold anymore, it's just going to come right out. We shouldn't even ask the bucket to hold anymore. So we should, with patients with dementia, if we just keep bombarding them with new information, it's just going to go in one ear and out the other. So we have an example today. This is our patient Susie. Susie comes into our clinic 3 times a week, and we've been seeing her for a while. And she loves to talk about her garden, and this is all she talks about, and how she loves to plant them and watch them grow, gets down to their level, checks the soil and the nutrients in the soil, loves when there's worms in there because it helps her plants grow. But as you're doing this and she's talking to you about this, you're trying to get her to do mini squats. She doesn't understand what you're asking her or why you are asking her this. So instead of having her in the clinic, take her out to the garden and utilize the exercises that she already knows. We must make the extra effort to individualize each treatment plan for each individual and unique patient. We must utilize the water that's already in the bucket, utilize what these people already know and the skills that they still possess.
Okay, so going back to our original example, do you think we could have done better? I think I could have treated you a little bit better. I'm sorry, Emily. So the real question is, why are we treating them this way? And really, we can treat these people more as individuals with substance. They have emotions, they have feelings, they have thoughts that are very similar to our own, and we can do better. Thank you.